Good evening. Welcome to Connect with Jacob Brier. I'm Jacob Brier. I'm coming from my home office here in Barrington. And I am here again for the, I'm not sure what number episode this is, but here taking an opportunity to remain socially connected while physically distant. As I mentioned on Wednesday, tonight I wanted to talk about the idea of striving to look foolish. Now, I don't mean actually look foolish. What I mean is we are striving to get to a place where we are looking back and saying to ourselves the toll, the hospitalization numbers, the havoc wreaked on our healthcare system, and the loss of life isn't as bad as we thought early on. And we'll get there by doing the physical distancing policies and closing down some businesses and working from home and really just having essential workers and healthcare workers out there so that we can give our medical community the opportunity to get the testing done and to treat the folks who have gotten sick so that we can get a handle on this. Now, Governor Raimondo actually walked back the early projection that she had, or the projection she had shared earlier in the week, because the projections had been improving as they kept rerunning the scenarios, and even the one she shared was worse than the reality we were experiencing at the time, and she corrected that. Haven't seen a new model, but certainly we're heading in the right direction, and we should be very grateful. What I had planned to do was to take this idea of doing so well that it seems as though you've done too much, and I wanted to look at some of the countries and other states that have fared very well in terms of their health metric success with the virus, and wanted to look and see what they did and what the leadership teams there had in common, just as a exploratory conversation. But I think it's important that we stay right on this topic, right on the topic of what we're doing and why we're doing it. Because what we've seen just over the last couple of days is the emergence of that you're doing too much attitude of, we've done this enough, it's not as bad as we thought, now let's end what we're doing. We had, just yesterday, thousands of people gathering in Michigan. There were protests in California, Colorado, Ohio, possibly other states as well. People gathering in huge numbers to protest the stay-at-home orders. They're doing the very thing that we're trying to avoid, which is getting a virus that may have infected any one person and bringing it close to many, many other people, which can be frightening and is a situation where we really need to look at what's being done and make sure that that we're all getting back to getting on the same page. And that's that idea of understanding we want to beat the projection. This isn't a situation where we want to say, oh, you're right, it was worse than we thought, because that's not an acceptable outcome that we can be going for. And I understand, I fully understand people are hurting financially. It is difficult to be out of work and to have no idea when you can resume work. And it's difficult to have your business close and have no idea when you can let your employees come back to work. And that's a scary thing. And I think what's happening is the economic fear is being masked as prudence. People are afraid, people who are having that economic fear are not seeing that their decisions are also based in fear, whereas it is obvious in some ways that that yes, the people who are saying please stay home, we are afraid of a virus. We're afraid of the toll it can wreak on our society. And we want to do all we can to prevent that. And we have measures that are backed by research and data and that we can see happening in other countries, because it did not arrive in Barrington first. It did not arrive in Rhode Island. It did not arrive in the United States first. It started literally on the other side of the world, and it made its way to us. And we have witnessed what can work and what we need to do. And so understanding that we do need to get back to work, we need to really make sure that we don't rush it, because that is when we will see a second wave and we'll see a surge come back. And a lot of the detractors, a lot of the folks who say that we're doing too much believe, and sorry, I don't know what a lot of them believe. I've seen many articles that suggest that folks see this as simply a bad flu, or something that's like a bad flu. And they say, we have the flu every year and it kills, tens of thousands of people every year. Well, anybody who has run a business knows that there's a certain amount of loss you have. If you run a restaurant, you know that bottles of wine can fall and break, that some food can spoil before you're able to use it, that some people come in and don't pay a check. If you run a manufacturing company, you know that some raw goods become either unavailable or things break while on the production line. If you have a software company, you know that sometimes your engineers are not going to be working on a project. And so you budget for that. You know what loss to expect each year. And while it is very cold to think of the flu in terms of budgeting for loss of life, and that is applying business to humanity can be cold at times, but I think it helps to understand the dynamics. We've put in certain practices. The flu shot, there have been, we hear it a lot more now, but there's always been the strong encouragement to wash your hands, and how long you wash your hands for. That's something, I learned growing up and have seen it and have told my son, you can't just get your hands wet with a squirt of soap. You have to actually wash them. So we've been doing things for a long time to mitigate the seasonal flu. And still we have loss of life with it. But we've done the cost-benefit analysis to know that we can do so much, and we're not going to completely get rid of the loss of life. But doing any more than that for something that's going to happen every year isn't a sustainable plan. But this virus is different. This is new. We've seen the devastation it can wreak on entire health systems in the state of New York, in Italy. We've seen what happens when hospitals are overrun with this because of the way that it makes people sick, the need for ventilators, which is a scarce resource that you can't just produce very quickly. And there isn't a treatment. And so we know that there's more that we can do in this period to help save lives. And we have that responsibility. And we're doing those things. We're doing them now, and in fact, we're doing them very well, especially here in Barrington and in Rhode Island. We have leadership that have put in place protocols that are keeping us mostly healthy and safe. And when we get to the end, there are certainly going to be people who will say that we've done too much. But we can look back confidently and know that we have done what was necessary. And there will be people, even though we're doing what is necessary, there will be people who get left behind, who at the end of this don't have a job to go back to or aren't able to restart their business. And I feel for those people, and I hope I commit to continuing to work to make our economic system, to make our world a better world for them to live in and thrive in. And that is something we cannot do for any life that doesn't make it past this period of time. For any preventable loss of life, there is no future to worry about. And that's why we're worrying now. We're doing everything we can now. You and I and everybody else need to do everything we can to save as many people. On that note, I wanted to share that tomorrow is Yom Hashoah. Yom Hashoah is the Jewish Day of Holocaust Remembrance, and it commemorates the loss of 6 million Jews and 11 million people to the Nazis during World War II. And at this time, on this day, Jews all over the world mourn. And as part of mourning, we say a prayer called the Mourner's Kaddish. And that is a prayer that by Jewish law is only said in a minyan. A minyan is a group of 10 Jews. We cannot gather in groups so large tomorrow. Whatever your beliefs are, whatever your religion is, please try and take a few moments tomorrow to think of and to hope for a world in which an infection, whether it be viral or fueled with hate, is able to attack the sanctity of human life. You'll find me back here Wednesday night at 8:45. Thank you for taking the time to connect. I am Jacob Brier, asking you to stay home and to stay healthy.